Hard to keep up with everything happening in the world, as you were just hearing, whether it's our politics or our personal life. More unique challenges are added for people of color. Not only are there ongoing societal pressures, but there's also stigma lurking internally in these spaces that often go unexplored. Tomorrow, Hegira Healthcare is hosting a virtual town hall featuring a panel discussion focused on how to reduce mental health care disparities. To talk more about the town hall and Minority Mental Health Month is Dr. Andrea Rodgers. Dr. Rodgers is the Director of Development at Hegira Health, which operates out of Metro Detroit. Dr. Rodgers, welcome to the Metro.
Hi, thank you so much for having me.
Yes, indeed. So what's happening tomorrow with the town hall?
So tomorrow, myself from Hegira Health and a few other mental health professionals from throughout the metropolitan area, we're going to be talking about Minority Mental Health Month, which is really to remove stigma, but also mainly to have some conversations about the advocacy needed to continue and the resiliency that is shown in minority communities as well.
And, just building off of that, why is it so important to highlight the POC mental health and just the importance of bringing awareness?
So there are several factors, including the stigma that is present, the disparities of care that is received. There's medical mistrust within BIPOC communities. There's so many areas that we need to continue to have conversations so that we can see an increase in services and availability.
And just always thinking about just personally in our own lives, in our own families, within our own cultures. What are some things that you experienced throughout your life that brought you to want to bring more awareness to mental health?
Me personally, I had the opportunity. I worked in IT for 10 years before I kind of pivoted and made this huge jump. But I saw something tragic, and it was suggested to me to get mental health services, and everyone who saw this tragic event. And it never occurred to me that the event that I saw was traumatic. I was like, we see traumatic stuff all the time in the community. And it was literally in that process that I was like, wait a minute, this is not normal. Trauma is not okay. Trauma should not be normalized. And so that was kind of the beginning of my personal journey to be like, hold up, I'm in the faith-based community as well. So there's stigma about receiving outside help. There's so many areas for BIPOC communities to thrive without the resources that they need to thrive.
Yes. And just building off of that, again, just being in those spaces, how does stigma show up in the world of mental health care?
So one of the reasons that Minority Mental Health Month exists, B.B. Moore Campbell in 2008 started this initiative for Minority Mental Health Month. And one of the things that she said, she puts it so clear. She said, people in minority communities do not want just another factor held against them. There's so many factors that is held against them. People of color are valued for their productivity. And so when there's something that impedes that, there's a stigma to be like, hold up, no, I don't think I want to go that route. Mm-hmm. That's just one area.
Yeah, just that extra label per se. Yeah, so if you can go on, if we can go into it a little bit more deeply, we've been talking a lot about it, especially on the show, young men and their mental health, especially young men of color and their mental health right now. I just want to know from your experience, from what you've been doing, what have you seen with young men, especially young men of color? Do you believe that it's happening more, or are we noticing it more?
So one of my specialty areas is children and childhood services. So one of the things I want to impact is, so people ask, do minorities have more issues or more mental health? There's a caveat to that. It's not that young men of color have more issues. It's they literally are exposed to more disparaging factors that causes more exacerbating symptoms. So if I have a symptom and I get it checked early, it doesn't show up more, it's easier to treat. And so men of color, especially young men of color, are less likely to receive the help when it's needed. So their symptoms are exacerbated. And depending on the culture in the home for men receiving help, or men, there's that stigma. Be a man.
Yep.
Don't you cry. Don't show emotions. We forget that anger is an emotion. So there's acceptable emotions. And then I could go on and on, but there's so much pressure on our young men to present a certain way that they don't get to be themselves.
Right now, we're chatting with Dr. Rodgers, the Director of Development at Hegira Health. We're talking about an event that's coming up tomorrow to help people manage their mental health, but also to talk about the disparities within the healthcare system. So what are you seeing within the healthcare system in terms of mental health? Not just awareness, but the practice of reaching out for mental health and reaching out. What are we seeing right now in those disparities?
So one of the main things is that there are levels of medical mistrust. So if someone reaches out for help and they are discounted, their pain isn't acknowledged, their situation is kind of put to the back burner, people are less likely to reach out for services in the first place. Then when they do reach out for services, sometimes they aren't trusted, they aren't believed. They are told, they are being emotional, and people show different signs. So they're like, well, that's not what I thought mental illness looked like. And so there are so many factors that go against that. That's why just this conversation, people having it just brings hopefully some awareness and some light bulbs go off and say, you know what, I can't reach out. And if I don't reach out and they're not listening to me, I need to reach out to somebody else.
Exactly. So just looking into what Hegira Health does, and you have the temporary stay services there for those who need a place to stay, temporarily, but you have that in place. You also have so many other wraparound services, whether it's art therapy, whether it's music there. There's so many things that you all are doing to kind of fill in those gaps that we are seeing within the healthcare system in terms of mental health, especially mental health within minority groups. So talk about the work that you're doing in order to fill those gaps and some of the things that you're seeing within the healthcare system that can also fill those gaps.
So when we talk about accessibility, Hegira Health has 10 locations in the Wayne County area. However, we are able to support the metropolitan area as a whole. So we do telehealth. We do in-clinic visits. We do community visits. We do home-based visits. And so that's a myriad of services that are available. So it's not kind of a one thing hits all, or you have to get to this one place. We're spread out within the community. We have a different level of evidence-based treatment. We do mental health, substance abuse, as well as comprehensive health care.
Yes. And just once again, thinking about the town hall that you all are going to have tomorrow and the things that you all are going to talk about, what can people expect when they're attending this town hall?
So we have some wonderful experts. I'm so excited about tomorrow. We have Cassandra Phipps from Detroit Wayne Integrated Health Network. We have Tracy Jackson, who is the director of intake at my side, as well as Angela Lopez from my side, and myself from Hegira Health. So you have people who are in different levels of in the community, but also different levels of services. So we have the overarching from Detroit Wayne. We have individual community mental health agencies. And so we can talk from that, but we can also talk from our own personal experience, as you were asking me earlier.
Yes, and yes, indeed. I just want to say thank you so much, Dr. Andrea Rodgers, the Director of Development at Hegira Health. Her organization is hosting a virtual town hall event tomorrow to help people manage mental health. Dr. Rodgers, thank you so much for being here on the Metro. And once again, just having the conversation is the start.
Thank you so much.